Imagine a world where a normal fever or a minor cut could kill you. You are taking medication on the prescription of doctors, but it won't save you. This is not science fiction, but it is becoming a reality, and India is at the front line of this new kind of silent pandemic. So, hello and namaskar. My name is Aditya Ajmera, and you are watching the news analysis series of Next IAS. And in this video, we are going to discuss a very important topic that's called antimicrobial resistance, or AMR. To understand it, we have to understand what are microbes. So microbes are basically the tiny living organisms which we cannot see through our naked eyes. We have to use microscopes. Examples like fungi, virus, or bacteria. Some are good microbes, but some are bad microbes. Good microbes help us to digest our food, it boosts immunity, and it builds nutrition for us. But bad microbes, these are the reason behind the deadly disease which can kill any human, like cholera, typhoid, or pneumonia. And to fight against these bacteria, we generally use some kind of medicines, which we call antibiotics. These antibiotics was discovered in 1930s. And it revolutionized the medical industries, not just medical industry, but also the meat and dairy industry. And it helped doctors to safely do the procedure of surgery operations. And over the years, what happened? The rampant use of antibiotics for just headache or minor symptoms of any disease trained these bacteria to resist the impact of antibiotics. Earlier, the antibiotics ruptured the cell walls of these bacteria, or alter the DNA so that the replication of cells can be stopped. But now, many of the antibiotics are almost useless because these bacteria, after exposing for several years, these bacteria mutated themselves and transformed into some kind of superbugs. These superbugs have the tendency to resist the impact of antibiotics. That means if you get ill and you are taking high dose of antibiotics, it won't work and it will not save you. And what are the conditions in India? In India, the antimicrobial resistance is one of the major health crises right now. Around 2.67 lakh deaths are directly related to the antimicrobial resistance in 2021. And that's a staggering number. So what are the factors behind these? We have several factors. The first is rampant clinical misuse of antibiotics. That means doctors can prescribe any kind of antibiotics to the patient. Because of the lack of time for diagnosis, doctors generally prefer to prescribe the antibiotics of broad range. They don't have time to analyze what kind of bacteria is causing the disease. And they will use a broad range of antibiotics in which not just the bacteria which is behind the disease, but several bacteria came in contact with the antibiotics. They mutate and they resist the antibiotics. Then we have pill pooping culture. It accelerates the consumption of antibiotics because the antibiotics are easily available over the counter. And this easy availability of the antibiotics accelerate the self-medication. So this forced the bacteria to evolve rapidly and mutate itself into the superbugs. Then we have the growth promoter epidemic in the livestock, not just in livestock but in aquaculture also. And poultry farms. Very high dose of antibiotics are given to the animals, not just to save them from the disease, but to make them swell so that they will look bigger and this will return higher amount of money. In the aquaculture, we have the shrimp and the poultry industry also use high amount of antibiotics because a large number of chicken are there in the poultry farms, and this can increase various kind of diseases. And to counter this, these poultry farms use high amount of antibiotics. It will make these places like a battleground, like a training ground for bacteria to learn how to resist the antibiotics. Then we have the pharmaceutical pollution. The untreated pharmaceutical waste dumped into the rivers or lakes, and this result in the unsafe amount of antibiotic. The untreated waste, when dumped into the water, this water will seep into the ground and it will mix with the underground channels and it will reach at our homes, and this increase the consumption of antibiotics. So without taking any pill, you are taking the antibiotics. Then we have the poor sanitation. Many of the hospitals have poor hygiene. The poor sanitation will result in the untreated waste and it will reach our homes through water, air, or food. And these are the factors which are increasing the antimicrobial resistance in India. Then what are the key threats these factors are posing on? We have the various kind of threats in India because of the antimicrobial resistance. The most important threat is the economic threat. The antibiotic contaminated shrimp and other kind of animals which are used to export to the other countries like Europe and USA. These countries have regulatory mechanisms to monitor the antibiotic contamination in their imported food. And what is going on? Many of the countries have banned the exports of India, especially the shrimp which are exported to Europe and USA. Then we have the antibiotic resistance, which can increase the expenditure in hospitals. In India, we have highest number of population with middle class income people, and these people have high expenditure over their health. But now if the antimicrobial resistance increase, this can make a severe impact on their income. We have several plans started by the government. The major initiatives like the National Action Plan on Antimicrobial Resistance, and this is the version 2.0. This is a strategic 5-year plans in which all the gaps which was formed during the first version of this National Action Plan on Antimicrobial Resistance will be taken over. Also, it have the concept of One Health, in which the animals, agriculture and humans all will taken as a One Health program. And it includes the strategic surveillance, increase in the engagement with private sector. These kind of programs will be run under the antimicrobial resistance version of 2.0. Then we have the AMRSN, the Antimicrobial Resistance Surveillance Network. It was launched in 2013, under which the data will be reported, analyzed for the antimicrobial resistance from the various tertiary level hospitals across the India. Then we have the Schedule H1 of Drugs and Cosmetic Rules. This is the amendment in the Drugs and Cosmetic Rules, under which the pharmacies have to maintain a separate record, separate register for the sales of antibiotics, and it is the initiative to counter the process of over-the-counter sale of the antibiotics. Then we have fixed dose combination ban in 2014. Before that, what happened? Various kind of antibiotics was cocktail in a single pill. That means a single pill will be enough to cure various kind of disease, and this led to increase in the consumption of antibiotics. Also, this increased the resistance of the bacteria against the antibiotics. This process of making cocktail of various kind of antibiotics was banned in 2024, under which several kind of antibiotics was banned. Then we have the Red Line campaign. It is an initiative on the public awareness to make a red line on the packaging of medicines so that it can indicate that this medicine must not be sold without the prescription of doctors. So these are some of the initiatives which was introduced by the government to tackle the antimicrobial resistance. So this is the tweet of Ministry of Health in which the Prime Minister Shri Narendra Modi is asking to the people of India, don't believe in the quick fix that the single pill can cure every illness. In the Mann Ki Baat, he initiated the National Action Plan for Antimicrobial Resistance version 2.0, in which the India reinforced its national commitment to curb the antimicrobial resistance through the responsible use of antibiotics, public awareness, and coordinated action across various sectors, various ministries. So this is what we have about the antimicrobial resistance. In the end, this is the practice question for prelims. You can answer it in the comments. Thank you.